Before starting on adalimumab, it's important to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you're using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional and the product package. Before using, visually check the product for particles or discoloration. If you see either, do not use the liquid. If you are taking this medication out of the refrigerator, let it sit at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication in any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. Make sure to learn how to store and discard medical supplies safely. Use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Tell your doctor if your condition lasts or gets worse. If you experience redness, itching, pain, or swelling at the injection site, let your doctor or pharmacist know. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you develop signs of infection or any serious side effects. Adalimumab may rarely cause serious liver disease in people exposed to hepatitis B virus. Get medical help right away if you have any symptoms of liver damage or very serious side effects. A serious allergic reaction to this drug is rare, but get medical help right away if you notice any symptoms. Remember, this is not a complete list of possible side effects, so if you notice other effects, contact your doctor or pharmacist. Before starting adalimumab, make sure to inform your doctor or pharmacist if you have any allergies, especially to adalimumab products, or if you have a history of certain medical conditions such as infections, blood/bone marrow problems, seizures, cancer, heart disease, or autoimmune disorders. Adalimumab can increase your risk of infections, so it's important to avoid contact with anyone who has a contagious illness. It's also important to inform your healthcare professional before receiving any immunizations or vaccinations. To reduce the risk of injury, be cautious with sharp objects and avoid activities that could result in cuts or bruises. Before undergoing any surgery, make sure to inform your doctor about all the medications and products you are using. For older adults, there may be an increased risk of infections and cancer while using adalimumab. If you are pregnant or breastfeeding, discuss the potential risks and benefits with your doctor before using this medication. It's important to be aware of potential drug interactions that may impact the effectiveness of your medications or increase the risk of serious side effects. Make sure to keep a record of all the products you use, including prescription/non-prescription drugs and herbal products, and share this information with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. Some products that could interact with adalimumab syringe kit include other TNF blockers, such as etanercept, infliximab, and other drugs that weaken the immune system, such as abatacept, anakinra. Be sure to discuss any concerns about potential interactions with your healthcare provider. If you suspect an overdose or experience serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical assistance. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. It's important to remember that you should not share this medication with others. It's also important to have regular lab and/or medical tests, such as a complete blood count and liver function tests, while using this medication. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, talk to your doctor or pharmacist to figure out the best time to take your next dose. Do not take a double dose to make up for the missed one. Remember to store the adalimumab syringe kit in the refrigerator, but do not freeze it. Some brands may be stored at room temperature, so check with your pharmacist or the product package for specific instructions. Once it's been at room temperature, don't put it back in the refrigerator. Keep the medication in its original container to protect it from light, and throw away any unused portion. Remember to keep all medications away from children and pets. When it's expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.